On Thursday, April the 22nd, 6 people have tested positive for COVID-19 after 758 people were tested for the virus this week, bringing the total number of known cases to 94. Director General of the National Center for Laboratory and Epidemiology under the Ministry of Health, Dr. Phonepadith Sangxayarath, said all of the 6 people who had tested positive for COVID-19 had come into contact with a woman from Vientiane who was found to have the virus last Wednesday.
ประเทศของปหรมีผู้ติดเชื้อถึง 45 คน
The figures were reported by Deputy Minister of Health, Associate Professor Dr. Phonepadith at a press conference on Thursday. The spike in the number of new infections raised the likelihood of a widespread outbreak in Laos and comes as the number of cases surges in neighboring countries.
ผลการตรวจออกมาแม่นพบเชื้อ
4 of the new cases were identified in Vientiane and 1 each in Sawanakhet and Bokeo provinces. The 89th person is a 24-year-old woman from Utumpon district in Sawanakhet province who returned from Thailand, where she had been working at a restaurant in Bangkok. On April 19, she traveled from Bangkok to Mukdahan province in a group of 8 and entered Laos at the second Lao-Thai Friendship Bridge in Sawanakhet. The following day, she provided a sample for testing, which returned a positive result, and she was taken to a self-isolation facility. The 90th case is a 31-year-old man who works in Bokeo province. On April 19, he ate at the Poteng restaurant and then went to work as usual in Tonphung district. On April 21st, he provided a sample for testing at the 4th Lao-Thai Friendship Bridge and became unwell. On April 22nd, the sample returned a positive result and he was taken to a self-isolation facility. The 91st case is a 28-year-old man from Sapantong Nua village in Sisatanak district, Vientiane, who tested positive for COVID-19 on April 22nd. The 92nd case is a 22-year-old woman from Nong Hai village in Hat Saifong district, Vientiane. She has been isolated after testing positive for COVID-19 on April 21st. The 93rd case is a 25-year-old man from Bung Kanyong village in Sisatanak district, Vientiane. On April 13, he traveled by bus in a group of 15 from Vientiane to Vang Vieng for Lao New Year. On April 17, he returned to Vientiane. On April 21st, he developed flu-like symptoms and went to Bung Kanyong Stadium to provide a sample which tested positive for COVID-19 on April 22nd. The 94th case is an 18-year-old man from Tat Long village in Saiseta district, Vientiane. On April 13th, he went to a party at Diamond Karaoke in a group of 14 people. On April 19th, he and 6 friends met at the 8118 karaoke bar in a room of 20 people. He tested positive for COVID-19 on April 22nd. 45 people are currently in hospitals around the country after testing positive for COVID-19. Also speaking at the press conference, Director General of the National Center for Laboratory and Epidemiology under the Ministry of Health, Dr. Phonepadith Sangxayarath, said all of the 6 people who had tested positive for COVID-19 had come into contact with a woman from Vientiane who was found to have the virus last Wednesday.
ประเทศไทยเนาะก็เดินทางมา